Hi everyone, good morning, good afternoon, good evening, wherever you are. I'm your host, Dr. Haider Shah. On behalf of Kalwas, I would like to welcome all of you to this webinar. Thank you very much for joining us. Today we have another very interesting topic, and I'm really honored to welcome and introduce our distinguished guest speaker who is going to talk about health and nutrition. What are the things which needs to be considered while avoiding the health issues and how to be more effective in life as well as a learner, student and professional. Indeed, a very interesting topic, and I'm sure in this session you are going to learn new amazing things and the best insight about all these things as we have an expert with us in today's this session. So stay tuned because an amazing stuff are coming ahead in this session. Before we start, I would like to thank Kalwas for arranging such enlightenment sessions for their support and providing us such a wonderful platform. The aim of Kalwas is to give you the opportunity to connect and interact with world renowned speakers, academic leaders, teachers, authors, researchers, experts, professionals, and businessmen to learn from their experiences, recommendations, suggestions, and tips which will create an impact and will enable you to learn and develop yourself in order to grow and transform individually as well as to contribute to the world in a positive way. As our slogan is calm, learn, and share knowledge. So today we have amazing person as guest. He's a wonderful expert and internationally known personality and always ready to share his knowledge. Let me introduce him formally. He's MD Central America, MS Public Health Peshawar, MS Nutrition Islamabad, American Board Certified in Drug and Food Allergy, Public Health Consultant, a nutritionist and medical research scientist. In addition to that, he is a member of a core committee Nutrition Foundation Pakistan, association member PNDS, and he is organizing committee member E. Tele Limited Liability Company USA. Furthermore, he has various research publications in reputed journals. In addition to that, he is working a research coordinator SIGNS International Pakistan. His field of expertise are public health, nutrition, medical research, and environmental health. Last but not the least, he's a wonderful speaker, author, teacher, researcher, professional, and above everything, a great human being. So please help me in welcoming our guest, Dr. Latif Khattak. Welcome to the Kalwas platform, and thank you very much for joining us, sir.
Thank you. Thank you so much for inviting me.
Yeah, thank you. It's really pleasure to have you with us, and now it's over to you, sir. Thank you.
Okay, sir. I'm thankful to your platform and especially to Dr. Haider. Uh, should I continue in English or can I talk to the Pakistani community in Urdu as well?
Uh, Dr. Saab, it's the international platform.
Okay.
Whatever you think it's fine with you, please go ahead.
Okay, I got it. So, being from a developing countries like Pakistan, I was thinking that we should go for that, but it's okay. So, it's my pleasure to be with you on a very special topic like nutrition and health. First of all, let me tell you before discussing this topic of health and nutrition, I would like to tell something about health. Uh, in common sense, in general concepts, people think about health that if I'm not sick, then he considers that I'm a healthy person. But nowadays, the definition of health is a little bit changed. If a person is mentally, physically, and socially well-being and healthy, then he can say that he is a healthy person. Not only physically, but he should be mentally and socially. He should be, with all respect, okay. Then he can consider himself as healthy. And on the other hand, if we go with the thing with the disease and opposition with the healthy status of a person, disease is any deviation, like every student know from very beginning we are talking about it. Any deviation from normal body functions we consider a disease. And from very beginning we are using medicines as a curative form for the diseases. But now recently in near past, nutrition, which was a neglected area in the field of healthcare system, now it has been considered by the United Nations, especially when they introduced it in their Sustainable Development Goals 2030. If we come across the goals of the United Nations, these are 17 goals, and almost in every goal we see the role of nutrition for the betterment of health in society. So, for nutrition and health system, we should think about a few things before. Before talking about nutrition, I would like to think about the healthcare system globally. If we look at the developed countries' healthcare systems, we came to know that we observe that nutrition is playing a very good role in their healthcare system, as it is included is on policy levels and national levels. But unfortunately, in developing countries like South Asian countries, especially Pakistan, India, Bangladesh, like these countries, we have no such systems. I will request the higher authorities to please implement the nutritional education on institutional level and universities and colleges levels. Especially, there should be some policies on national level to introduce nutrition and dietetics profession in the healthcare system of Pakistan, and especially countries like Pakistan, developing countries, which will directly influence the health status of the society. So, coming towards nutrition, first of all, I would like to start with the special aspect of child nutrition. So, if everyone knows that family have a very much important role for everybody. Especially kids are very much precious for everyone. So, school in kid nutrition system, we give importance to school nutrition, which is very neglected, especially in South Asian countries. And school nutrition, if we come to the South Asian countries, we observe that there is too much diseases uh, prevalent in the society, which are directly associated with nutritional factors. Like in Pakistan, we see 40% of the kids are stunted. They are with low height for age, and almost 30% of the children are wasted. They are with the disease, nutritional disease of wasting, and 17% of almost every Pakistani is undernourished. So this is a huge ratio of malnourishment in Pakistan, especially. So first of all, if we are to bring better health status on the society level, we should start from school nutrition health system. We should educate our teachers regarding the importance of nutrition in the school system. We should educate parents about the importance of nutrition in the career making, in the brand development, in the memory status of the kids, and in the better attainment of their goals in the future. And when we introduce the nutritional courses and nutritional tips and nutritional experts on school level, it will enhance the growth of the students. It will reduce the stunted population. It will improve the quality health, and generalized health system will be improved, which will bring you a good and healthy population. And healthy population always bring you healthy minds, which in turn will improve the not only the economics health status of a country, but the economic status of the country will also be improved. So on the other hand, in nutrition, we should also we need to give importance to mother child health system. Most of the nutritional diseases, these arise from uh, prenatal periods before pregnancy of the mothers, and antenatal period during pregnancy of the mother, and postnatal period after pregnancy time of the mothers. This nutrition and these three phases are very much important. And any lack in these three periods of the mothers, that can cause the children's with low birth weight, with diarrheal diseases, with stunting, with wasting, and with marasmus and kwashiorkor like diseases, which in turn turn to be a big burden over the society, and which another hand, which is a big loss for the country, in the form of youth, in the form of a new civilization. So after that, we come across the bariatric population nutrition. That is the nutrition related to the people, old citizens, above 60 years of the population is geriatric population, which is this nutrition is so much important because these are the people who are mostly hospitalized in any community. So these are direct burden on the society, direct burden on a national economy as well. So if we take some good steps to overcome the nutritional aspects, and which the factors which are related to some disease, which can be overcome with the introduction of nutritional factors, which can reduce the disease mortality and morbidity ratios, the disease prevalence ratio, through implementation of nutritional directions, that can be a good aspect and good addition to the society, to the health society. So these things are related to nutrition and public health. On the other hand, on educational level, as far as I consider, we should start on school level, if it is not possible on school level, but on college and university level. Every country should start some nutritional programs, uh, and some practical nutritional programs, which should be implemented in the society, not only on the academic level but in the practical level. And the researches which are done in the field of nutrition, they should be implemented in practical and true sense in the community, which will bring some good positive changes to the community. So nutritional diseases, if we came across the few important nutritional diseases which are related with nutrition, are like some of them are systemic diseases like diabetes mellitus, which is directly associated with nutrition and lifestyle habits, and hypertension, cardiovascular diseases, renal diseases, kidney diseases, and up to some extent, due to these synthetic items uses, we can say that cancer is also associated with nutrition. So these are the few diseases which are also on the top 10 table of disease globally. These are directly associated with nutrition. So how we can overcome with these things? For that, I would like to share some healthy tips with my viewers. We should somebody asked me about unhealthy lifestyles. So unhealthy lifestyles are like somebody is with sedentary lifestyle. He is every time he is sitting and like no active life, no physical exercise. He is not going to do a walk. He's going to he should be, he has a tendency for smoking, and he is using some junk foods and increased sugar intakes and high cholesterol and high fats rich diet. So these things are considered as unhealthy lifestyle things. So for good nutrition and good health, one should do regular walks, active life, active physical life, and one should take low sodium diets, low carbohydrate diets, and one should have an important thing and with nutrition is a good sleep, good rest. Mental rest is too much important for a good health. So one should at least we should take 8 hours per 8 hours and 24 hours minimum sleep on regular basis. And there should be as per our understanding, there should be proper ways, uh, proper timing of the eatings. So one should have to have a specific time for breakfast, and then he have some specific time for morning snacks, and specific designated time for lunch, and early dinner is very much important. The major aspect of gastrointestinal disorders throughout the globe is which we are facing is late night dinners, which is causing too much gastrointestinal disorders like constipations, diarrheas, liver disorders, cardiovascular disorders, and stomach disorders like that. So for that, we have to go for early dinners, and important one important thing is taking plenty of water, and especially cold water is too much dangerous for health. So we should follow warm water drinking technique, which is very good for not only for gastrointestinal tracts but also for our cardiac health. So these are few tips for the common friends, and if there is any questions, so I'm most welcome to all of them.
Yes, thank you very much, Dr. Latif. Really, what a great talk you have given. And I love the way you started it from the what is healthy life and what is health. Because mostly what you have mentioned is the right thing, that mostly it is being considered that if you have any kind of disease, so you are not healthy. But not actually in terms of mentally as well as the
Social.
socially. What are the two important aspect of the life health as well? It's not the physical only. So I think that is very important, that first we need to understand the basic definition or the concept of the healthiness, that what is healthiness. So very nicely you have established the definition first, and then I like the way you talked about the school system, that we should have the basic understanding level at school level, that what is the best nutrition and everything. And nicely you have mentioned about the role of the university, particularly colleges, that there should be awareness programs over there, maybe degrees, kind of, so that there could be holistically awareness for the nutrition. And I really love the way you talked about the role of the mother, particularly in nutrition perspective, and how it can be more strengthened and promoted in order to have the wonderful and healthy people around us. Really, the people who are suffering from health issue are really a kind of that we need to take care of. So really, I enjoyed the way you talked about the different thing, and particularly the healthcare system. That is very much important, and particularly the role of the government and policymaker. Yes, we would request them that please have a wonderful policy so that more and more masses and general could take benefit out of their nutrition healthcare policy. So now we would like to have few questions with you, which is I think very interesting, and people they really want to know. Dr. Latif, you also talked about the balanced diet. So please please share with our audience that what do you describe or recommend as a balanced diet? What is balanced diet? Yes, please.
Okay, so actually, diet is what we are taking as a food. But the balanced diet is if our diet or food items have all the important essential nutrients which are required by our body, like in the form of protein, carbohydrates, fats, and minerals and vitamins. Because some vitamins and minerals are very much important. You can go so for some days without carbohydrates or proteins, but without important essentials, vitamins and minerals, which are very much very much necessary for our nervous system, for our brain. If we are not with getting with them, it can cause serious health issues. So every food which contain our essentials, nutrients in a good amount, in a balanced amount, that is called good balanced diet. And in other terms, balanced diet can be the diet which is up to your mood, which is up to the one client mood, and which not come under the classification of overeating or undereating. And these the food item which are also enriched with all the essential important nutrients, that is called balanced diet.
Wow, very nice. Thank you very much for your elaboration. And now, please, there is one another interesting question that they want to ask that Dr. Latif, please educate us on fruits and vegetables intake as a part of routine. Yes, what is your recommendation on that, please?
Fruit and vegetables are very important part of our diet chart, especially fruit and vegetables are rich with fiber, which is very much important for gastrointestinal tracts. And fruit and vegetables have important minerals and vitamins as well, which are not present in other in such amount rich amount in other foods. And they play a very vital role in reducing the cholesterol level. They reduce the sodium level, and indirectly they are responsible for lowering the blood pressure. And with lowering the cholesterol level, they are helping an individual to control the cardiac diseases. Fruit intake and vegetable intake reduces the heart attacks, especially like paralysis, which is very much common in Pakistan. This is too much. This is reduced by the increased intake of fruits and vegetables. So with fruits and vegetable addition in a diet chart and food chart is very much healthy habits, and one should go on regular basis with it.
Yeah, thank you. I'm really enjoying the way you are giving answer. And Dr. Latif, nowadays you know better that there is a lot of intake of the junk food, and there is a trend of the fast food because of the busy routine, and we have a less time for the eating as well. So please share your special strategies for eating well. What strategies you follow particularly uh, for your meals and particularly your eating habits? Yes, please.
So for eating habit, I will suggest that everyone should go for twice for a medical checkup. Every year we should go twice to our physician for generalized checkup, and twice to a nutrition specialist, I would suggest. And with their consultation and their direction, we should define our habits of eating. So we should plan a diet chart for us with direction of the nutrition. And as far as concerning the habits and habits of eating, there are two worries in the habit of eating. One is overeating, which leads to obesity and some other disorders, and one is undereating, which leads to generalized weakness, fatigue, and muscle pain, etc. So to overcome these two situations, one have to make a timetable. As per my understanding, one should go for a proper timetable. Like we have some specific time for duties, we should properly label our time for breakfast, for lunch, for morning snack, for afternoon snacks, for night dinner, and for bedtime snacks. So we should have a proper time, and we should have, as far as I know, we should have a written diet chart or diet plan for our daily routine, which will enable us and will control our excess taking of anything like which is not good for health.
Yes, thank you very much, Dr. Latif. And Dr. Latif, now another very interesting question regarding the nutrition list or label whenever people buy the product. So please share your opinion. Do you look to the nutrition labels as well when you are trying to buy any product or to consume anything? Do you see that labeling? And if yes, what do you see in that labels, and how do you purchase the product for yourself? Yes, please.
Yes, actually, with the latest advancement in food industry and beverage industries, so now food labels are very much important, and also the community is now aware of it. So, if like any nutritionist is going to purchase or buy something, so yes, we go for observing of food labels, and we go for the calorie intake. We take into account the calorie intake, the carbohydrates which it have, which is called the sugar intake, and other items like it have artificial flavor, etc. So we definitely go for it, and we try to select those food items which are with less with less sugar and with less carbohydrates and low fat diets. We mostly
Wow.
prefer these things which are with low sugar intake and low fat diets.
Yes, thank you very much. One last question, Dr. Latif, that is regarding to the teachers, the lifestyle, and particularly the healthy style. Because if the teacher is fine, teacher is healthy, so definitely he's able to teach very well, and the student will get the benefit out of it. So, what are some particular challenges for staying healthy as a teacher? Yes, your recommendations for them,
Okay,
please.
teacher is very important. Teacher has very important role in the society because he is educating the nation. The schools teacher, whether he is on school level or he is on college or university level, teacher should be healthy, not only physically, but he should be mentally and socially, he should be perfect in all respects, so that he can transform his knowledge to the kids with all his responsibilities and rights. So for teacher health, as he has some mental stress and workout which is related with mental stress, so he should go for a proper exercise one important thing for teacher as far as concerned, walk, daily walk for morning, and morning 25 minutes walk and evening 25-minute walk is very much important for a teacher life, because walk is a thing which is you can say it is opposite to the stress. With work you can decrease your stress level, you can decrease your anxiety, and you can go out of depression with the work. And exercise, even it can be for 10 minutes per day, but it's a good addition in a teacher life. At the same time, I would like to advise the teachers across the globe that they should try to be uh, calm and cool. But how you can be mentally well and calm and cool when you are taking proper balanced diet, you are having good exercise and walk on daily basis. And one important thing which is very much good for teacher is they should start warm water as drinking water, which will help them to not only to reduce their gastrointestinal problems, and not only which will help them to reduce their cardiovascular disorders, but it also will decrease their anxiety and stress level, which is a good addition. And at the same, they should be socializing. They should opt for outing once a month. These things are very good, healthy lifestyles, in addition to balanced diet. And they should avoid junk foods, and they should increase intake of fruits and vegetables, which will result in good health for them as well.
Wow, thank you very much. And really, sometimes teacher they go through extensive study and teaching routine and so much to do. So definitely, your recommendation of walk is very much good for reducing the stress, particularly, and avoiding the junk foods and etc. Really, that's very important recommendation for them. And I'm sure that the viewers from around the globe they would have taken a wonderful suggestion from today's session, and you shared a very wonderful tips with our audience regarding the healthcare system, regarding the role of the mother, particularly the child, and the middle age, particularly the old age. So we have to take care of ourselves in terms of the healthiness which you define on three perspective: physical, mental, as well as uh, the another one which is very interesting is this social one. So we have to take care of all these things. Thank you very much, Dr. Latif Khattak. At the end of the session, we ask each our guests about their message to the world. So, what is your message to the world as a speaker, author, teacher, researcher, trainer, learner, professional, and educator? Yes, please.
Being a medical research scientist, my message to the world, especially to the health community, is just I will request him to serve the people without any financial benefit, and to the academician and researchers to share their knowledge without any financial benefits or anything like that. We should share our knowledge with juniors, with seniors, with colleagues, with interaction with each other globally, which can bring a revolutionary change in the miseries of the world, which are nowadays faced by the developing countries, underdeveloped countries, especially developing countries like Pakistan and India and Bangladesh, like South Asian countries. So together we can make this thing habit, then good for health, with sharing knowledge without any other financial benefit. So my advice is, my request is to please help the poor and share your knowledge. Thank you.
Yeah, thank you very much, Dr. Latif. You have given a wonderful message to the world. And I think that is the contribution back to the society when we share our knowledge, particularly for free. And I think this is what the teachers they do, that they not only teach in the universities, but whenever they get the chance in any gathering or any conferences, they would like to speak and they would like to share their knowledge in order for the betterment of the society. And I think that's the basic responsibility of the teachers, researchers as well, that whatever they come across and they learn, they must share with the audience for the larger interest of audience, because somebody else will take advantage of their experiences and their knowledge. And I think this is what a wonderful you have said as well, that sharing knowledge is actually caring. And I think knowledge grows when shared. So definitely, the more we share the knowledge, the more better place it would become, the more better planet we would have. And this is the real contribution back to the society. So really enjoyed and love your this session, which was
Thank you.
very comprehensive, very good. And thank you for being so generous, and thank you for taking out your precious time and sharing your knowledge with us. To the audience, that please do follow our distinguished guest speaker through his research work, and you can email him for future learning and guidance. He is very generous and always ready to help the people. Moreover, wonderful explanation the speaker has already elaborated, and that will help you to develop your understanding regarding the health and nutrition. So take advantage of all the information, important tips, and suggestions shared by an expert. So that's all we have time for today. Thank you once again, Dr. Latif Khattak. And I would
Thank you.
like to thank the audience who join us. If you have any additional question about information shared today, please email us or connect to the speaker directly through his email or social media account. Thank you all for your support and liking our session. Stay tuned as many sessions are on the way. Please do not miss any session. Until next session, take care of yourself. Bye bye.